Assalamualaikum and a very good morning. In this video, we will show you how to perform supraclavicular block for shoulder trauma. This block can be performed with the patient in supine, semi-sitting or slight lateral position with the patient's head turned away from the side to be blocked. Place a high-frequency linear transducer superior to the clavicle at the midpoint and parallel to the neck. To achieve the best possible view, the transducer must be tilted slightly inferiorly. The goal is to see the subclavian artery in the transverse view and the brachial plexus posterolateral to the subclavian artery. The first structure we need to identify is the subclavian artery. Subclavian artery is readily apparent as an anechoic round structure. The brachial plexus can be seen as a bundle hypoechoic round nodules just posterior and superficial to the artery. Some describe the brachial plexus structure as a bunch of grapes. We also need to identify pleura and first rib. These structures are linear hyperechoic structure immediately lateral and deep to the subclavian artery. We also need to identify middle scalenus muscle on the lateral side. We are using Stimoplex 360 50mm needle using in-plane approach. To visualize the brachial plexus, the transducer is oriented in the sagittal plane until the first rib is seen deep to the plexus and the artery. So we aim first to deposit the LA at the inferior trunk of the brachial plexus. For analgesia, we are going to give ropivacaine 0.2% 10 mL at this inferior trunk of the brachial plexus. We aspirate. Once there is no blood and clear, we inject the LA. So once we have created a space, then we push in our needle at the pocket of the brachial plexus. Next, after we deposit the local anesthetic, 10 mL, we flatten our needle and the next aim would be the superior trunk of the brachial plexus. Once we feel a pop, then once again we aspirate and make sure there is no blood. We inject about another 10 mL of ropivacaine 0.2%. So total there will be 20 mL of volume. So this is the spread of the LA, and you can see the brachial plexus is flooded with the LA. Thank you.